Hey guys, Adam with Behm Muscle Joint Clinic. Today we actually have Laura with us, and so she's going to go through our Stretch Saturday video. This is a neuromobilization. So basically, what that means is we're kind of getting our nerves to kind of slide and glide. So not really stretching our nerves, just getting them to slide and glide down through the muscles of our arm. So this one's specifically for the median nerve, which is commonly involved with carpal tunnel. A lot of times we're spending time either weightlifting currently, gripping, or a lot of times at the desk, so we can kind of get those nerves can kind of get stuck or entrapped along the way, specifically from our neck down to our wrist. So this one is for the median nerve, which exits our neck through our brachial plexus and goes all the way down to our hands. A lot of times if you have tingling in these three fingers, or feel like your hand's asleep and you need to shake it, this would be a good neuromobilization or a stretch to do. So for this one, Laura's just going to kind of sit up nice and tall. Her hand's just going to kind of dangle in front of her. So think her fingers are just pointing straight down. And then I'll just have Laura kind of bring her hand out to the side towards me. So she wants full extension of her elbow. And then she's going to try to look at her hand and point her fingers down back as far as she can. You'll feel a little like flush sensation. That's good. That's the nerve. That's not the muscle. You'll feel the muscle stretching probably if it's tight. But if you feel a flushing sensation all the way down, kind of the tips of your fingers, that's just the nerve. You're kind of gliding that and stretching that. Or just gliding it back and forth. And then she'll go back to the starting position and do another repetition of that. So I always like to say maybe do 10 of them. So have her do the same thing on the right side. So do a couple more for us, Laura. And then she would do the same thing on the left. It is important, though, if you're doing this and you're feeling a sharp pain or anything like that, stop and probably get evaluated. So we treat people with carpal tunnel issues, thoracic outlet syndrome issues all the time, but this is just a great technique to do, even if you don't have carpal tunnel issues, to just keep that nerve kind of sliding and gliding down the arm. Just because we spend so much time typing at a desk anymore, those tend to get kind of entrapped. So give this one a try. Definitely, if you're having some type of carpal tunnel, tingling in the fingers, these three fingers, the whole hand, the outer two fingers, give us a call. That's something that we treat pretty regularly.